Hey guys, I am a respiratory therapist and I'm here to give you an informative speech on the exciting world of respiratory care. The simple act of breathing is not something that most people think about, but when you're struggling to breathe, that is the only thing you think about. So when we think about that, it's a matter of your life and you breathing. That's what we say in the hospital. That's what a respiratory therapist is called for. They're one of the elite members of the healthcare team when it comes to managing your cardiopulmonary part of um, the patient. So when it comes to that, we work hand in hand with doctors, pulmonologists, specialists to diagnose, treat, manage, and educate patients. It comes with any chronic disease with your lungs. So whether you have asthma, COPD, emphysema, any chronic illness that you have, a respiratory therapist will be in your treatment care plan and will be there to take care of you. So it comes from as little as babies right out of the womb and as older as the geriatric patients, which are the older patients on our team. But it's a fast-paced job, it's a very rewarding job, and it's something that I wouldn't trade for anything in the world. There's always something going on, you're moving all the time. So being a respiratory therapist is something that's a very rewarding job, just because you make a difference in someone's life, and when you feel part of that team, that you're able to make a difference in someone's life, make them better, it's great. You are considered the expert of the cardiopulmonary part of the patient's care. So you work with the doctors, you're doing the consultation. So we're the eyes, ears when it comes to the respiratory status, whether they're on a ventilator, whether they're on a CPAP machine, whether it's a BiPAP, invasive, non-invasive. You are the eyes and ears to that. You are the first one to titrate, maneuver, and make your recommendations to the doctor. So respiratory therapists, they work in different kinds of fields. So you get your first clinical setting training is in the hospital. That's where you sharpen your clinical skills, your bedside manners. You become part of a team, and you're communicating. It's a different, basically a different scene every day. It's not your regular 9 to 5 job, Monday through Friday. You go in and every day you expect something new. It changes every day, so that's what always keeps you on your toes, and you got to be ready for anything. A patient can code at any time, so that's where you start. You start there at the hospital, and then you can actually expand, you become different credentials. You can become a neonatal specialist, you can become an asthma educator. So with that aspect, you can move from being in a hospital, you can move into a home health setting where you come into patients' home and you treat them, or you can do diagnostic settings where you work and you treat patients with sleep apnea. So you do their sleep tests, you become certified in that. So patients that are in need of respiratory care, doesn't matter what age it is, like I said, it comes from peds to elderly. So it just depends where you want to specialize in. Me, I personally want to pursue more in educating myself to become a neonatal specialist. I find that it's a very rewarding area that, some of my colleagues do say that being in peds and being in the neonates, it's one of the top. But you can also do flight. You can also be a flight therapist. So you get called to the big transportations when you're transporting from a massive casualty incident. You transfer them from where they're at, from a hospital to a trauma level hospital to a different one, and you're in charge of keeping their pulmonary status at bay and making sure they get to that facility alive. So to me, honestly, it's a very rewarding job, and it starts with schooling. So if you have a knack for wanting to help people and make a difference in their life, and patients, the patient care is something that you think about being a respiratory therapist. You start off, you need an associate's degree. Once you get your associate's degree, you sit down for your board. Once you sit for your your therapy multiple choice exam, you get your test, you apply for your license in the state of California or whatever home state it is that you are going to be applying for, and you start putting your applications out. And one thing that one of my teachers always said is one application a day for 30 days. You throw your applications out there, and it's awesome when you can get hired through your own internship site, because that means you made a good impression on that side. And we get many students that come in that shadow us, and we go and do our rounds and everything. So it's awesome. I can't express it anymore, but being a respiratory therapist is an elite job. It's good to say that you're a respiratory therapist. Like you you are someone that makes a difference in somebody's life, and in the healthcare field, you everything changes. So with that being said, just you learn to adapt, you learn to improvise, you learn what's needed, and you're the key component in this patient's treatment plan. So so either way, if you want to go 2 year or 4 year, you can go either one. Obviously 2 years, a lot of people go in that, but it opens it up door. So if you something you wanted to do, and let's say expand even more, as a respiratory therapist, you can even expand to being a PA as well. So that's also another good thing, and have your background in respiratory. Most physician assistants have their background in that, so it's awesome. So if you're a people person, you love to help people, being part of a team, respiratory therapist is the way to go. You become part of an elite team, part of a healthcare team that helps patients, and it's a rewarding job. And honestly, wouldn't trade it for anything else. I hope you guys look into it and want to go in there. According to the AARC, it is one of the most rapid growing fields in the system, just because lung disorders are going up as well. So, get into anything. Totally recommend it.